Mm.
I guess it's still good morning. Good morning, everybody. We're just going to give it a couple more minutes here to get people signed in. Thanks for joining us. It's just right now noon, so I think we'll just give it maybe 1 or 2 more minutes just to make sure we don't have any last stragglers.
Sounds good.
Well, I'll go ahead and kick us off here.
Hmm.
Welcome, everybody. Thanks for joining us for our second of your our disability prep just disaster prep training, our building our own personal plan part two. I'm Brooke Lovelace. I'm with the Iowa Developmental Disabilities Council. Just a couple of housekeeping things. We do have an interpreter who should be pinned for you. And then we also have the ability to do closed captioning down there if you hit the two, or I'm sorry, the three little dots that say more. You can bring up the closed captioning. There should be time, I think, if folks have questions today. It sounds like, Nick, is that correct? That people can
Correct. Yeah.
ask some questions. So I'm excited. The DD Council is excited again to have Nick back for this. Nick is with Disaster Wise Prep out of the University of Iowa College of Public Health. And this, as I mentioned, is our second part of the building your plan. With all of that, I think now I'm going to turn it over to Nick to kick us off and get us started.
Sounds good. Thank you so much, Brooke. So yeah, I will go ahead and just share my screen and we can go get started. So thanks everybody for coming back. Um, I'm glad that we've got people here who are going to go through and help keep building their plans. So today we're going to talk about your household's vital information. So last week we sort of started with um, building, getting asking some questions that you might need to ask yourself to help prepare and help, respond to shelter and evacuate if necessary. And then you started to think about your own personal emergency network. So people who can help you do those things that you need to do to help prepare. And so this week, we're going to actually get into putting down what you need for you and your household, the information that you need on hand in your plan that will help you prepare and do everything. So, once again, FEMA, the Federal Emergency Management Agency, recommends people be informed, make a plan, and build a kit to be without outside services for at least 3 days. And so we are solidly in that make a plan section now. So today, we last week we went through steps one and steps two. So we completed our personal and household inventory. We developed a personal emergency support network. And so now we're going to get our emergency information and documents in step three. And in step four, we will have keeping a 3 to 5 day supply of medications and medical supplies. Um, so like last week, this is going to be kind of interactive, pretty interactive, hopefully. And it will hopefully not take as long to get everything set up this week since everybody should have their accounts ready to go. So, first thing we are going to do is we're going to log back into PrepWise. So, you can use the same email and password that you entered last week. If you are joining us for the first time, I don't think I saw any new names in there. But if you are joining us for the first time, if you want to just shout out in chat, that you are in need of a username, I can give you one of those, and I can have one of our we have a couple of our AmeriCorps members, Lauren and Hala, in the chat who can help you get started and set up. But for everybody else who was here last week, please log into PrepWise. Ah, got the core recording. I could use a bit of help, it sounds like. All right, so we got a couple of people who need the usernames. So, all right. Well, let me hold on one second. I can get you guys set up here. Okay. So, all right. So, you know what? We'll just go through since we've got a little bit of time. If you are new, I will go through really quickly. So let's see here. We've got two people who are in need of usernames. So, um, actually, no, we've got two people. We got Hala and Lauren. I'm gonna have each of you. Let's see. You know what? We've got time. I will just have you go through, we can just go through it again. Um, So when you go to the prepwise.org website, you'll see the main login page. So if you were logging in for the first time, Ann and Rachel, I gave you both those temporary usernames in the chat. They're all lowercase. If you want the first time you use that, um, enter the same exact thing, all lowercase, in the username and the password, and then click login. Um, After that, it will take you through a few pages uh, that will have you change your username to your email address. So you could just enter in your email address, and that way, if you forget the password, it can send stuff back to you. Let's see. Um, and then right, and then once you've changed your username, it'll ask you to change your password. Um, uh, if you are having trouble, you can message. You can just shout out in chat, and then one of our AmeriCorps members will be able to help you through that stuff. So do we have any? So we've got Anne, Rachel, and Lori. Do we have anyone else who needs a password for this week? Okay. So if you're in need of any help, please let us know. We've got a few people in chat who will be able to help out. And the nice thing about PrepWise is that it's not necessarily a linear, it does not have to be a linear experience if you don't want it to. So you'll be able to follow along with us to do steps 3 and 4 today, and then you can go back and take a look at steps 1 and 2 while you're following along with the recording from last week. So thanks for joining us. All right. For everybody else, if you are not logged in, go ahead and go to prepwise.org and log in with the same information from last week. So, sorry. Almost forgot my password. All right. And so if you're returning from last week, this is what you'll see when you log back in. It's the same thing that you saw. It picks up exactly where we left off. So steps 1 and 2 are finished. Um, I had you all click on the download the disaster plan page last week, um, just to see what's going on. So today we will start focusing on steps 3 and 4. But before we have a little bit of talking to do. Just a reminder about what steps 3 and 4 are about. So step 3 is getting that emergency information and documents. Um, so each person in your household, so this is going to be the part where we start to differentiate between how many people are in your household. Each person in your household is going to need some personal information in there, and that's just good if you're handing this plan off to somebody who does not have that information on hand. It's good to have it all in one place. so that it is available for, one of those personal emergency network members if they need it. You also want to make sure that you have medical information. So you want to have information about your medical conditions and how you're gonna treat those or how you're gonna manage those. Information like allergies, blood types, communication or physical limitations, things like that. You're also going to want provider information for your household members. So there will be spaces for doctors, emergency care, insurance. I'll show you more of that in detail. Step three. All right. Hold on one second. Yes. Hala will be able to help you, Lori, um, to help you get into prepwise.org for the first time. All right. So yes, so each person in your household, your household in general will also need potentially some emergency contacts, which are different from your emergency network members, and I'll explain that. Um, and then emergency meeting places as well. Once you have all of this information, all of your information compiled, you're going to need your personal documents as well. So either the originals or the copies, you're going to want to make sure that you have ways to access those. And you're going to want to have them in multiple places, ideally. The more places you have it, the more easy it will be to access them when you need it. So you're going to want to make sure to have some copies in your take and go bag, which we'll talk about in a couple of weeks in the last part of the webinar series. You'll want to keep it in an easy to reach location in your home. The places that emergency responders will check are the back of your door or the front of your refrigerator. If there's anything that, is labeled as important, those are places that people are going to check for emergency information. You also may want to keep it in an out of town location. So if there's somebody that you're going to be sheltering with out of town, or even somewhere like keeping it on the internet in the cloud, emailing it to someone is a really easy way to do that as well. Having, a digital copy or keeping it in places like in your car, in your purse, or in your wallet. This is also the point where we like to talk about scams. Generally speaking, there's a lot of really great banding together that happens in a disaster situation. But unfortunately, there are people out there who may want to take advantage of you if you're in a weak or unsafe position. And so there are a few things that you can be looking out for while you are um, you know, in these high pressure situations. So you want to look out for high pressure sales. If somebody is encouraging you to complete a transaction now, it has to be done now, right away, right away, right away. There could be something up with that. Um, you want to make sure that you're not being pressured into anything. You also want to look out for people asking for financial information. So you don't want to give those numbers out to just anybody, or services provided with no written contract. If you don't have anything written down, it becomes sort of a, he said, she said situation. And those, are much harder to sort out when everything is taken and finished. So those are just a few things you can look out for. We'll be sending these slides out, and there's a link to the page on the FTC website that has more information about dealing with scams post disaster. Okay. So now that I've sort of explained step three and why we are doing it, let's actually go take a look at it in the website. So in the Action Center on the left side of that homepage that you're logged into, um, step three, develop emergency information and important documents. You can go ahead and click begin. So it's going to begin the same way that all of the other pages have begun, with information about the step and why we do it, the video that has a lot of that same information on there. Those are both for you for reference, or if somebody else is looking at the website, they can see what step three is all about. So we are going to want to scroll to the bottom. This is where the informations for actually using the website are. And we have all of these are the instructions. This is what we will actually be doing today. So this section includes several forms to help you put together important personal and medical information that can be used in case of emergency. These forms do not need to be completed all at once. Take time as needed to collect the information you need to thoroughly complete this section. The forms in this step include medical and healthcare provider information for yourself and each household member, family emergency meeting places, family contact information, and a list of important documents. Medical and healthcare provider information should be completed for yourself and each individual living in your household. After completing the introductory page, a set of medical and healthcare provider information forms will be created for each individual on the following menu page. You can use the right or left arrows or the menu button at the bottom of the page to navigate between individual household members. Refer to the video for more detailed information about completing the form. So if you click next, you will see what that is talking about. So the first page of step 3 is setting up your household. So last week when I showed you your plans and told you that they would eventually have your name on them, this is where that name actually comes from. So the first thing you want to put down in step 3 is your name, full name. So you got the first and last on there. What you type in that box is what is going to appear on the front of your plan. So I've typed in my name. Mhm. And now we are going to set up for the rest of your household. So the next question asks how many other individuals live in your home. If you live alone, click 0. So if it is just you, you can go ahead and click 0. If it is you and one other person, you can click 1. If it's you and a couple of other people, you can click 2. You can add all the way up to 5. Does anybody in here have more than 5 people living with them in their household in here? Okay. If you do, um, I can give you a separate, basically the best way that we've found to add more people is just to have people have a second account. So if somebody has more than 5 additional people living in their household, we would just give them a second account number. They can fill out steps 3 and 4, and just add additional people into that, as many as they need. But for everybody in here, just click on the how many other people there are living in your home, and then it'll ask for names. Again, you want to put first and last name in there just so that you have all of that information. So, okay. And so for each of the people that you would enter the name for, including yourself, there will be pages added to your plan. Every plan is going to have at least 3 pages for the person filling it out. But if you have 2 people, it'll have 6 pages. If you have 3 people, it'll have 9 pages and so on. Um, and then I will actually go through what those pages are right now. So once you're finished entering how many people live in your home, you can go ahead and click next. Okay, so the first pages will be about yourself, if that is the name that you've put in for that first box. So this will have personal information, uh, date of birth, street address, home phone, cell phone, etc. So you can go ahead and fill that out. Um, okay. Once you're finished filling out the personal information, there are emergency contacts. So these are distinct from your personal emergency network members. These are not necessarily people that you would think would help you, but they are people that you want to know how you're doing. So if there's somebody who, say, lives far away, they live in New York or California, they may not be able to help you out, but you want them to know how you're doing if something has happened. So they're not, anxiously checking Facebook for any updates about what's going on. So it's important to put those names into these emergency contacts. So you can add in people, name, who they are, and any contact information. We've left that general, so you can add email or really any way to contact someone. Like it could be Facebook Messenger. I don't know. It depends on them. But you'll have a couple of spaces for that. There will be a couple of spaces for those for each person in your household, and there will be another page with more emergency contacts later. So if you have a lot of friends who you want to keep updated on your status, you can add them all to these emergency contacts. Below that, we have medical conditions and a lot of sort of medical information that's important to note. So for the medical conditions box, if you add anything to this, um, once you've clicked away, it will add a second box um, that asks what care strategies work best to manage these conditions. So you can put your list of conditions into that first box, and then there's instructions for anybody who might need them. These instructions are really good to share if you're sheltering with someone and you need their assistance with, you know, whatever it is that you are needing to do. So there's an extra box there that will ask that question. Um, we also have boxes asking about allergies. We have blood type. We have boxes for any special dietary needs or restrictions. There's a box for communication difficulties or recommendations. There's a box for physical limitations and accommodations. And there's a box at the bottom that's other things to note. So if there is anything medical that does not fit into any of these boxes, but you want to make sure that it is on your page, you can go ahead and put that in the other things to note box. I'm gonna take, does anybody have any questions? All right. I'm gonna take just like 30 seconds and I will let people fill out the box. If you need more time, let me know. We can take a few more. We can take a minute or so. Um, but I think I'll wait maybe 30 seconds or so just to give people time to fill stuff out. Um, all of these things you can come back and fill out later. The instructions said you can always come back and fill out information. Any information that you yourself don't have, you can just come back, fill that in. So anything that you put in these boxes today is going to save, and you can always add anything that you don't have or want to go back in and change later. Okay. Okay. So now that we're done with the first page, the next page is going to be your healthcare provider information. So, when I said you can come back and fill things out later, this is kind of the page that I was thinking of. So you've got on this page spaces for three different doctors. Um, you've got a space to include your preferred hospital or emergency care information. You've got a space that you can include pharmacy where you get your prescriptions filled. You've got a couple of spaces for insurance. You can add Medicare and Medicaid in there. You can add your private insurance. You can kind of add whatever. We've also got a couple of spaces for home and community-based providers, a space for a care manager, and then at the bottom we have an other space in case there's any other information that you want to include in there, separate dental insurance, additional providers, anything that is relevant to this list of phone numbers and names. Um, so I'm just gonna take a second and fill this out for myself. And see, I can't think of the hospital's address off the top of my head because I never have to think about it. And so I can come in and put that information in there later. Okay. Does anybody have any questions? Would anybody like me to spend more time on this page? All right.
Nick, Nick, I don't have any questions.
Yes.
I just want to say this is the first time I've seen this, and I think it's really nice. It's definitely something that I need to get my things together to be able to fill out, but it's really cool to see all the options there are.
Yeah,
So
thank you
I
so
just wanted
much.
to
Yeah.
comment on that.
Yeah. Yeah. And the nice thing about the internet and the login stuff is that you have the flexibility to come back and add stuff in later. It's not an all or nothing all at once sort of thing. So yeah, thank you very much. I appreciate that. We appreciate that. All right. So we'll go ahead. Um, and so I was slightly wrong. It's not 3 pages per person, it's two. So you have one page for the personal information and medical information, and then one page for the medical contacts. So if you are living on your own, you should be seeing uh, a page with some meeting places. I will get to those in just a second, but I will say a few things if you are filling this out for your second person. So it asks for a little less personal information. We assume that since it's a household-based thing, everybody is on the same address. So we just have the different information for each individual person. So date of birth, cell phone, email. They do have a couple more emergency contacts, and all of the medical conditions information is the same as well. Um, huh, okay. Um, Hold on 1 second here. Okay. All right. Okay. So yeah, so emergency contacts, medical contacts, and then for medical contacts, um, we only have you can if you and your second person share all of the same medical contacts, same pharmacy, same hospital, same doctors, you can actually just click no. Does the second person have any doctors or that are different from the first person? If they do, we can add any. You can click yes and add any that you don't share or that person does not share with you. And then you don't have to add in names for a second time. So if your second person has one or two doctors that are different, you can add those names in there, but you don't have to add the hospital and the pharmacy if that information is the same. Okay. So once you're finished filling out the pages for your household members, you will go to this meeting places page. So we have three different spaces for three different meeting places. And so you want to you want to have a few different meeting places depending on the scale of the emergency. There's some that are only going to affect your house or your house and the houses in that immediate area. And so you can have a space that's in your neighborhood. And then there may be bigger things. There may be large storms, heat waves, derechos that will affect larger areas. And so you also want to make sure that you have a place that you can meet out of your neighborhood and a place that you can meet out of town. The features that all of these meeting places share is that it should be something that everybody knows. So you want to make sure that everybody in your household knows where to go if a disaster is happening. And you want to make sure it's something that is easily accessible for everybody. So, for your neighborhood emergency meeting place, it could be somewhere as simple as like the big tree across the road or the stop sign at the end of the street, somewhere that everybody in the household knows, everybody in the household is easily able to get to, because you want to make sure that everybody's evacuated from your home before you move on to wherever you're headed to next. When you're thinking about out of neighborhood emergency meeting places, this is you want something again easily accessible, but in this case, it might be like a big parking lot, Coral Ridge Mall parking lot, a park, a nearby a community center, something that is everybody knows where it is, everybody knows how to get there, and then once you are there and you can meet there, um, you can go on and go ahead to wherever you're going to be sheltering after you've evacuated. We generally, for the out of town emergency meeting place, we recommend putting in where you think you might be sheltering if it's out of town. So this could be, a family member's house, a friend's house, somewhere that you can shelter. Um, but again, make sure it's a place that everybody knows where to go so that you have these meeting places if you do get separated during a disaster. Does anyone have any questions? Take a look at chat. Okay. And if anything does pop up questions, you can just you can shout out in chat. You literally just unmic and ask me. This is, we're I'm trying to do this as flexibly as possible. So um I know it's a lot of me talking, but I'm trying to break it up kind of as much as I can. All right. We'll head on to the next page. The next page is just more emergency contacts. So, if the two on your page, or the two plus two on you and your partner's page or whatever, um, if you need any more than that, you can add up to five additional emergency contacts in here. It asks all the same questions. Um, uh, but I'm just going to go ahead and leave it zero. And then we get to the last part of step three. So, uh, this is your important documents checklist. All of these questions are categories of documents. Um, I like to say we at Disaster PrepWise do not actually need to see your social security card and your insurance information, but we do want you to know that those are important things to have when a disaster is happening. Having the originals, having the copies. And so we've broken them down into categories: identification, insurance policy information, bank account information, any legal papers, so wills, deeds, marriage, birth certificates, powers of attorney, guardianship, conservatorship papers. Um, you want an inventory of household goods. These are really helpful, whether it's a list, photos, or we've had suggestions just taking a video of anything important that you want to make sure is inventoried. These are good for replacing goods after disasters once you're starting to recover. Um, Important school and professional papers, and contact information for local and out of town friends and family. Um, so for all of these questions, we have the answers are the same. The three possible answers are: I have copies of the documents in my kit. So if you do already have a disaster kit for yourself and all of these documents or the copies of those documents are in that kit, you can select answer one. Um, Most people we talk to either do not have a kit or do not have the copies of these things in the kit. And so they're likely going to select one of these two. Either you want to make copies and put that in your kit, or it's not applicable to me in my household. Um, you know, if you don't have any important school or professional papers you want to keep around, it's easy to click that button. But for most of these, you'll want to select need to make copies and put them in my kit. And that just serves as a good reminder that you want to, make those copies, paper copies, digital copies. You know, both is obviously going to be more effective than just one. Um, a lot of people are a little, a lot of people come into meeting with us and say, "Well, I know where all of my papers are." So, as long as I know, you know, when it's time to evacuate, I can just go get them. It's fine. Um, but it is important to remember that, there may be disaster situations where you are not the one going to get those papers. So I'm sure that especially for the people who are attending this webinar, there's probably a lot of very organized people, and you probably like can picture in your head the file folder where all of those files are. I mean, I can picture it in my head for where it is in my house. But it's also good to keep these copies available for people in case that you are not the one going to get them. Um, and so you want to have those copies because the worst thing in the world is not having any of these things and having to go get new copies of, say, a social security card after a disaster without any of that information. All right. There's also another action steps box at the bottom here. So if you think of anything, especially related to copying that stuff, if you need a child or grandchild to help you out with that, if you need to go, you know, Kinko's or whatever, you can add that into the action steps box at the bottom there. That'll print directly on the page in your plan. And once you're finished checking off those checklists, that is step 3. So once again, this ending page is the same for all of them. You want to click that I have finished step 3 box, and that'll make this drop down up here so that when you come back next time, you'll be able to jump to any page you want. It's especially helpful for step 3 because you'll be able to jump to the individual pages for your household members. So if you need to, you know, change your partner's healthcare provider information because you don't have the phone numbers on hand, you can just jump right to that the next time you come in. But you want to make sure you hit save and return to home, and that will take you back to the PrepWise homepage. Okay. So, does anybody have any questions about step 3? That is the longest step in the whole thing. Step three is the biggest. It's got a few different components, especially if you've got people in your household, it can grow pretty big. But that is as complicated as it gets, I promise. Step 4 especially almost feels like an addendum to step 3. Um, so we'll go into that a little bit now. So I will jump back to my PowerPoint. Um, Again, like last week, all of the instructions, all of the things that I've been saying are also included in this PowerPoint. I will send that out so that people can have it on hand. Um, it goes into a little more detail than the instructions on the website, but we're going to go into step 4 now. So step 4 is keeping a 3 to 5 day supply of medications and medical supplies. So your goal, once again, is to care for yourself for at least 3 days. And so you want to make sure that you have a 3 day supply or more, if you're able, of any and all prescriptions and medical supplies. You want to make sure you can do that by refilling prescriptions and supplies as soon as possible. Don't wait till they're gone to refill. You want to make sure as much as possible that you're keeping medications and supplies in one place. So you can have your emergency supply in your emergency supply kit. Of course, we do understand that there are medications that you cannot put in your kit. There are medical supplies you cannot put in your kit. Sometimes things are too big. Sometimes insulin has to stay in the fridge. There are, reasons why not everything can sit in the same place. And so if there's anything that has to live in a separate place, put a big, post-it note, white piece of paper that's got some Sharpie on it that says get insulin, get Walker, get, wheelchair repair kit, stuff like that. Anything that's not able to stay in your kit, you want to put a big note on there. That way, if you're evacuating, you will make sure that you remember that. Um, of course, we understand that there are also a lot of medications out there that are not as easy to refill. Um, and so sometimes people might be without them or have a smaller supply. We have some questions that we recommend people ask their doctor and pharmacist, all about what you can do if you're maybe not going to have the prescriptions or the supplies that you need. What can I do if I can't get treatments? What do I do if I think I'm running out of medical supplies? Is it okay to stop or reduce my treatments? If I do reduce or stop my treatments, how do I safely do that? What other changes do I need to make? Dietary or activity-based changes. Um, so this is a good list of questions. And then after I talk about step four, um, we have this. This is part of a worksheet that we have available on the Disaster PrepWise website. I will show you where that lives, along with all of the other extra information on the PrepWise website. So uh, we'll put a pin in that. But back to the actual filling out of the website. So we'll jump into step four now. So step four, again, has your instructions and your video on the opening page. Um, we scroll to the bottom here. The first page of step four actually has a link to the emergency medication plan. So you can download that with those questions by clicking on this link, but I'll show you another place to do it that's a little easier to get to on the PrepWise website. And step four includes two forms to help you put together information about prescriptions and medical treatments. So, medications and prescriptions will be on the first page, treatments and medical equipment will be on the second page. For step four, we again break it into by household member. So, you'll do the same if you click next here. You'll do the same thing that you did at the beginning of step three. Um, I'm aware that it would be much easier if we were able to just tunnel the names from step three to step four, but we have tried that. I promise you, there has been no way that we've been able to do it that has worked. So I'm very sorry. Um, it's just gonna you're just gonna have to do the same thing twice. It's really annoying. But the nice thing about step four is that this name is not going to show up anywhere. So since you already have the names in step three, it's much easier to just put first names, nicknames. You can put whatever you want in there as long as you know that they're for the same people that are in step three. So I've put in my name, I put in my mom's name. And all of the other questions were exactly the same as that first page from step three. Once you get into step four, the first page for you is just going to have 20 spaces for medications. Um, this can get long if people have large medication lists. If people have more than 20 medications, there is a box on the next page that's like an other box that you can continue to add prescriptions if you need to. But there's a list of 20 of them on here, and they'll show up pretty much as you exactly as you put them in the boxes on your plan. So you want to make sure that you're including as much information as possible. So you want to include how much you're taking. You want to make sure you're including the prescription name, the brand name. You want to make sure you're including how often you take it, if you need to take it with a meal, if you need to take it with anything else. Any dosing information is going to go in there. Other than that, you can just have your list of medications in your plan. And then on the next page, you have spaces for medical treatments and supplies. So this first box um, is a box where you can include any instructions for treatments. So if you have any medical supplies or adaptive equipment that you may need help with, this is again one of the places where you can put instructions for your emergency support network members. If they may need to help you with anything, you want to make sure that they have some written out instructions so that they're not relying on you in a stressful situation or you when you're not, totally conscious or able to give instructions. Below that, we have spaces for medical supplies and equipment, a space for adaptive equipment, And then that bottom box for action steps I need to take. So, medical supplies and equipment, that's things that are going to go kind of inside you. So, catheter, infusion pump, ventilator, um, your adaptive equipment, wheelchair, walker, bath chair, etc. These are things that are going to kind of exist outside of your body. Um, Again, you want to make sure you're including as much information as possible. So, name, size, serial number, where you got them is a big one. There are some things that are easily accessible on Amazon, and then there are some things that you're going to have to go through a specialty supplier. And so you want to make sure that you include all the information so you can get replacements easier and quicker, and figure out, getting the exact same thing or getting something as similar as possible, will be a lot easier the more information you have. And then the action steps I need to take box will include, you can include any additional medications in this box. You can also include, if you need any action steps, like if you need a reminder to write down instructions for treatment, like if you have not thought of that before, you know, if you need to replace something, you can add that. If you want to get a second copy of something, you can add that. The action steps I need to take about your medical treatments and your medical supplies. Does anybody have any questions about the medications, about the supplies, treatments? Okay. Once you click next, if there are any other additional people in your household, you'll get the exact same pages, but for them. So, for your partner, your spouse, um, your child, your parent, you can include the exact same medication and prescription information for them, and the exact same treatment information, medical supplies, adaptive equipment, etc. Once you've gone through every member of your household for step four, that is it. Step four, much shorter. So, on the last page of step four, select that I have finished step four button. Um, It'll pop up this again. You can jump to your pages, your partner's pages. Um, it makes it a lot easier to jump around if you want to like go back in and add a bunch of prescriptions later. You click save and return to home. All right. So that is step three and step four for today. So those are the two steps that we're going to cover today. But before I have you take a look at your disaster plan again, I would like to also show you, as I mentioned before, where we can get that worksheet with the questions, as well as a whole bunch of other really great resources. So on the home page, at the top, you've got three tabs: Home, Files, and Additional Resources. The Files tab here, this does not have anything in it. I can explain what this is. This is we thought we wanted to include a place for people to put digital copies of their files, and then a combination of it being harder to maintain, as well as people just not wanting to put their files up on the cloud with us. So the files, we can't get rid of it, but this is what it is. That was all that it was. But if you click on the additional resources page, this has everything. Um, the additional resources page has these documents, which are for specific types of disasters. Um, the plans that we're building are for every type of plan, but living in Iowa, there are some plans that are going to be more relevant than others. So we've got tornadoes at the top there, fires, floods, all very common in Iowa. Extreme cold, extreme heat, radiation. We've got radiation, biological threat, hazardous materials, pandemic. Um, Cedar Rapids are reopening the nuclear power plant, and so radiation maybe be more of a concern in eastern Iowa. Who knows? Or maybe you're moving somewhere like California, where they're more inclined to have earthquakes. You're moving to Florida, or you're vacationing in Florida, and you're not sure what to do during a hurricane. Disaster PrepWise, the website, has all of this information ready for anybody. If you click on, it'll download a PDF, and it will give you information about this. So, for example, for tornadoes, it's got some information about who is at risk for tornadoes, how you'll be alerted of a tornado, um, what to do before, during, and after a tornado. All of these files are going to work all that same way. Below our disaster information, we've got some checklists and some emergency documents. So we're going to talk more about the checklists next week with step 5. But we do have one of the checklists. So we have is our important documents checklist. So this is going to have that same list of documents that was at the end of step 3. So you have a checklist of legal papers, your identification, your health and financial information, um, any of the disaster PrepWise documents that you want. Um, we have a a full checklist for documents. Yes, Brooke.
All right, Nick, I just wanted to make sure people knew that we were not meeting next week, but the
Oh, sorry.
following week. I
Following
just
week. Yes.
wanted,
No. Yeah. Thank you. September 1st is when we will come
yeah.
back. Next time. Thank you. Um, Yes. We also have emergency documents. So our emergency medication plan, that's the document that I mentioned before. So this is the box that has questions on it. What do I do if I can't get treatments? What if I do if I'm running out of medications or medical supplies? How to safely stop taking or reduce taking my medication or treatments? And I need diet or activity changes I need to make. You can print one of these out. You can bring it with you the next time you go to your pharmacist or your doctor, and they'll be able to fill those out with all of your knowledge. We also have a lot of additional special considerations. So we've got these are all PDF documents. So these will be PDFs about what to do to help prepare your car, what to do to help prepare your home, what to do to help you prepare when you're at work or in a public setting. Um, if you or someone you love is has Alzheimer's and dementia, um, what to do specifically with that. We'll go into a little more detail when we next meet on September 1st. Um, what to do to maintain your emotional well-being. Um, it's disasters are very stressful, and there's been a lot of really good research about the connection between stress and your physical health. So if you are more stressed out, it takes longer to recover. If you're somebody who's stressed out a lot, that's going to negatively impact your health. And so you want to make sure in a very stressful situation like a disaster that you're trying to maintain your mental well-being as much as possible. So we have a lot of different really helpful additional resources on that additional resources page. All you need to do to use those is just log in and click on whichever ones you think are interesting. If there's something that you would like to see a document of that we don't have on here, feel free to reach out. I'll click the home button here to take you back to the home page. Again, our contact information is at the bottom. If you're using the website and you're like, I have some specific questions about a specific condition that someone in my family has. Do you have any more information on that? Um, we can either send you anything that we might have, or if we don't have anything, we can go find out. We have a lot of people working with PrepWise who are, taking interest in a lot of different areas or would love the challenge of doing some research on a particular topic. So if there's something missing from the website, please let us know. As we're trying to expand, we really want to make sure that we can cover as many bases as possible. All right. So we're finished with step 3 and step 4. I've shown off the additional resources page. So the last thing I'm going to have us do before we leave is once again download that disaster plan. You can click it. It will download a PDF again. It'll take a little longer because there's more text in it this time. Um, there it is. And then in your downloads, you will see this time it has your name on it. That's what I really wanted to show off. Your name right on the front cover. So this is your plan. Um, as you scroll down, all the answers that you put in for last week, those are all going to still be in here. Those don't go away. Those will always be there. Those action steps, the yes, no, unsure, your personal emergency network members, those are all going to be in there. And then as you scroll down further, you'll see your information from today. So I've got my page that has my personal information on it, my medical information. I've got my page with all my provider information. And then it's got that same page for the other person in my household. Below that, you've got those family meeting places. So you've got three different places. Um, you've got your checklist of important documents. So these is everything that you said you wanted to make sure that you had copies of is going to be in this checklist here. Um, and then you have your medications and prescriptions for you and anyone else in your household as well. Again, um, we will go next time, 2 weeks from today, September 1st. We will go through step 5, the last main step, and then we'll also spend some time looking at our supplemental steps. So if you're someone who is a caregiver, we have a specific supplemental module for you. If you're somebody who has a pet or a service animal, we also have a specific module for you. And for everybody who lives in the state of Iowa, if you're not already signed up for Alert Iowa, we can show off our functionality with Alert Iowa, as well as I'll talk a little bit more about Alert Iowa and really how awesome it is because I can't say enough good things about Alert Iowa. But before we take off, does anybody have any more questions? Let's see here.
I do, Nick. I support a team of folks that are then like service coordinators in the community.
Yeah,
If we were supporting someone to kind of fill out this plan, it seems like having them, like our service coordinator, reach out and help establish that account might be the best first step, and then
sure.
downloading that finished file and putting that in their case
Yeah.
file. Is that kind of what you envision for someone who maybe has some extra support in their life?
Yeah, absolutely. We work really closely with Heritage AAA as well as a couple of the other AAAs in the area. And we've trained some of their staff members on like how to go through and help people build their disaster prepwise plans. It's very flexible with like how independent people want to be. If someone wants to go fill it out on their own and then have that information with someone who's helping them out and organizing that stuff, they can do that. If somebody wanted to sit down and like go through it step by step, we could help with that too. We're actually putting the finishing touches on an online training module for interventionists. So if somebody wanted to learn how to sit down with somebody and go through PrepWise, we can send them the training modules when those are finished, like absolutely sure by the end of the year, like hopefully end of September. I don't know. We don't have like a hard date on that. Um, but yeah, so if you wanna reach out to me, we can definitely, yeah, like because we could either just send you some usernames and have you hand them out to people, or you can help people set up the accounts, kind of the way that we did um, at the beginning of our last week's webinar.
Perfect. Thanks, Nick.
Yeah, thank you, Kyra. Does anyone else have any questions? All right. Well, if anything pops up, feel free to email me. I'm happy to answer any questions that anybody has. Um, it sounds like, Diane, if you wanted to stay a little bit, I could potentially help you, or we can see what troubles you're having with the website. But for everybody else, thank you so much for coming back or coming for the first time. We have a few first timers here. Um, and yeah, we'll see you September 1st. We'll talk about step 5. We'll finish things up. Yeah, thanks.